Assalamu alaikum wa rahmatullahi wa barakatuhu, everyone. Good evening and welcome to Left My Heart at the Masjid. You join us on Monday, April 13th, alhamdulillah. And as you know, every Monday we do Mental Health Mondays. I'm your host, Kashif Osman, and I'm delighted to be joined by a panel of wonderful experts on the topic of substance abuse and domestic violence. I think these are two prudent topics, both generally and especially during this time when we're in much close quarters. I read an interesting article today that said the next wave of this coronavirus pandemic will not just be physical, but it will have mental health consequences as well. And a lot of people might want to turn to substance abuse or prescribed substances that might be outside the norm of their usual behavior. So it'll be very interesting to talk to our panelists today. Some of you might even know that North Carolina is the nation's leader. Actually, Wilmington is the worst city in America for opioid overdoses. So I think that'll be very interesting to learn from our experts today, just some practical advice and suggestions to preventing these plagues and ways we can stay safe during these times. So we're joined by three wonderful and very highly talented experts in the field. We have Dr. Shaida Maroof, who everyone will remember from last time, psychiatrist and leader of the IAR health team. We're also joined by Sister Asma Hanif, who is the director and founder of the only women's shelter, Muslim women's shelter in the United States. It is a very innovative nonprofit, and she provides assistance for women who are escaping domestic violence, poverty, and homelessness. It's very exciting work that she does, Sister Asma Hanif does, and she helps to fill the gap. This women's shelter that she started, I believe it's the Muslimat al-Nisa, has, since its founding in 1987, has served over 5,000 community members and provided job trainings, food and clothing drives, and of course, beds for those without shelter. In fact, President Barack Obama honored her for her outstanding work with an invitation to the White House in 2014 at a Women's History Month celebration. So I'd like to welcome Sister Asma Hanif to talk to us, inshallah, about domestic violence.
Assalamu alaikum, everyone.
How are you today, Sister Asma?
Mashallah. When you were talking about the mental health component, it's like everyone is going through it. So imagine if you're not only having to do like you're stuck at home, you don't have the ability to be able to, to speak with others or be with others in a company to relieve some of that stress. It's already difficult, on your emotions. But then if you're a victim of domestic violence, it makes it even worse. And something that I didn't realize until they started writing about it, in terms of there's an increase in domestic violence during this time. And I don't really know, because they just say there was an increase in calls. So we don't really know if it's because the abuser is stuck in the house and he has no one else in which to harass, beat, take through changes, or is it that the individuals realize that they're not compatible, and that's the reason, and she wants to leave. So it makes it hard to be able to even provide assistance to individuals when you're trying to be able to determine, what is what's the reason behind this increase in calls. And when they're using the statement sheltering in place, at that point means that the woman is now faced with, I have no place else to go. There's no one who can help me. The other shelters are even the shelters where maybe be in that neighborhood are not receiving new clients. I've got an increase in individuals contacting me for shelter. And so imagine if you're already in a desperate or frightening situation, and you're stuck realizing that I can't even leave. So a person is being forced to stay in the house and have to choose, have all their options taken away from them, as opposed to, well, I can actually walk out the door and I could go to a shelter and I can find some kind of, sanctuary. And then to have that removed, that in and of itself has to cause some additional mental health, stresses. It has to, just to know that you can't leave. And even when, and Muslim Al Nisa, the shelter that I provide, I have my hands tied to some degree, because before, if someone just called me and said that they needed shelter, they say, Alhamdulillah, where are you? When are you able to leave? We have a window of opportunity, and I figure out some way to get them from wherever they are in the United States. And that option has been removed, if for no other reason than I now have to know, have you been tested negative for the coronavirus? Or have you been in a place or a location where you've been there for at least 14 days and now trying to be able to receive them? So when before I could just, I could accept a sister, I can't, because I have to do due diligence on behalf of those who are already in the house. And you're having to choose one life over another. Because if I bring someone in and then they have the virus, I'm risking the lives of others. So when we're talking about a mental health situation, is for everyone involved. The only person whose options have not been really reduced are the abusers, because he was performing the abuse anyway in the first place, which is why they would want to leave. But now, instead of her being able to just walk out the door and cut that off from him, his ability to be able to just abuse her, he knows that you have nowhere to go. You can't leave. I could beat you within an inch of your life and you can't leave. So that in and of itself would cause the women to have a feeling of hopelessness or helplessness.
Alhamdulillah, Jazakallah khair for that wonderful introduction, Sister Asma.
Oh, I'm sorry. I didn't know it was an introduction. I was just going on and on. I apologize.
No, you can go on and on. I wanted to just thank you for starting us off like that. You can always talk. This is just a conversation between us.
Oh, okay. MashaAllah.
Alhamdulillah. I think that's the fact that you also offer that service of where you work with women who are in these situations and create an opportunity for them to leave. That's an often under or forgotten elements of this, that just the leaving of the abusive situation can be very difficult as well.
Yes.
So that's awesome to hear. At the end of introduction and whenever you continue speaking, I'm sure our audience would love to know how they can get connected and assist with Al-Nisa and their adventures, inshallah. But I'll let you get back to it.
Oh, you say go continue?
Oh, go on, yeah.
No, I just don't know, in terms of time. I want to be, considerate of everyone's time and everyone's wanting to speak. If I had a concern, the main concern relative to this is because everyone is dealing with the constraints of not ability to have tests, and trying to get help and support from the Muslim community is far more difficult now than even if it was before. Because this to get a sister, because I accept sisters nationwide. It doesn't matter where they are. This is not a government program, which is also serves the benefit to those who I have been providing a sanctuary for. because where the other shelters had to close down because of they didn't have staff, or or have to pay in terms of the facility itself when they did government shutdowns. Then shelters is one of the main things that no one that they would see as being essential. So imagine that a grocery store a grocery store is essential, and trying to think of the other places where they had said that they were essential, people could go to, but a shelter is not. So as long as society sees it as something that's non-essential, and you can cut government funds, then we will always have a category of women who there's no recourse, for them.
Alhamdulillah, that's really tragic to hear that a lot of shelters either shut down or declared non-essential in certain parts of the country, and we consider grocery stores. I know that some places down in Florida, Alabama, considered churches essential, and said that you can still have public services or beaches and various other facilities that I would not consider essential to be essential, but yet they shut down women's shelters and were sort of withdrew funding from these, and that's tragic to hear. As you mentioned, how the number of cases and calls went up during this time period.
And even with the counseling, the individuals who may have been on the domestic violence hotlines, they're perhaps they can work from home, but everyone, if you're not going to get paid, you may, and if it's not a part of your, I say ministry, meaning that is you were doing it for the pleasure of Allah, the pleasure for, that's why you were doing it, as opposed to, no, this was your job. Okay, I don't get my income anymore. So, oh, well, victims of domestic violence, I feel for you, but, my life comes first. And I'm not criticizing individuals. I'm just saying that the options for victims of domestic violence during this time has been, drastically reduced. And the only thing that when someone is calling me from somewhere else in the United States, because before it didn't matter, they would, whatever state they were in, I would still, whether I did a fundraiser or, send out an email asking for transportation for the women, they would still be able to come. Now, if someone's calling me from California, there's nothing I can do. I cannot override the sheltering in place, or can't get on a plane. I can't override that. So all of these things are negatively impacting victims of domestic violence. And imagine that. It breaks my heart to even think about that you're already a victim, and now you're being doubly and triply victimized, because before you thought there was a way out, it is none. It is none. Because, they're not going to let you on the plane. They're not going to let you on the plane, and they're not going to receive you in these other shelters. And I've received a lot of, also many calls from other shelters asking me, was I still open? And the reason why is because they couldn't take people anymore. And I says, well, yes, I'm still open, if for no other reason, because I was not dependent upon government money. I wasn't that, I've never depended on government money. I depended on, the help and support from the Muslim community. And if I was to make any type of a plea, it would be for the Muslim community to understand that even in this time of crises, while we're trying to help so many others, because I know people are sending, money to, many different places, but then we also have individuals in this country who can be helped if we also direct some of our care and support. I'm not saying stop helping anyone else. I'm saying just give victims of domestic violence, a piece of the pie, so to speak. MashaAllah.
Allah, I think that's a very apt analogy that we should give everyone a piece of the pie, and it's a great point that those in these hotlines might not have the ability to staff them at the normal capacity that we usually undergo. So that brings me to a question for you that one of our audience members also asked. Vanessa Rawlings, how can we as individuals help out? What can we do to assist the Elisa Center or other domestic violence centers across the country? What can we do?
Well, when I answer that question, I always speak on behalf of Muslimat al-Nisa, because and not being selfish, but it's just that those other shelters, because they get government money. And the only reason why they're not providing services right now is because that government money has stopped. Whereas, mashallah, alhamdulillah, it did make a difference in the service that we're providing. So, and you did mention in the opening about Muslimat al-Nisa, it absolutely was the only shelter established for Muslim women, allowing them to be able to travel from wherever they are in the United States. And I'm not being, and so it doesn't matter in terms of, I'm not territorial, it doesn't matter about your city or state or county, none of that, or your status. And even if there may have been shelters that were established by Muslims, their rules are different in the sense that they will accept, everyone else. And I want the community to know that in establishing a shelter exclusively for Muslim women, it was not a discriminatory or prejudicial action. It was because I think about myself as an African American, that what you do is that you fulfill an unmet need. And that was an unmet need. And something that Dr. Ingrid Mattson, just so you also know, you mentioned that I am a chaplain. I went to Hartford, and not Harvard, but Hartford Seminary.
Hartford Seminary, right.
Yeah, right. And so Dr. Ingrid Mattson was my professor as well as my counselor there. And I was getting a lot of, not a lot, but I was getting comments from the Muslims that they were saying, well, no, you should open it up, the shelter for everyone. You should allow, people, it doesn't matter, about their faith base. And they said it would be a form of dawah. Well, possibly. But what I learned is, I said that, and we're talking about mental health again, that a shelter is not a venue for dawah. That's for the masjids, that's for the Islamic centers, that's for those types of individuals, because the people there are already going through some type of mental health crisis themselves. They need to be able to get work on themselves, get themselves together, and not be held responsible or accountable for someone who's coming in and say that they have to now, give them dawah. And that was my original decision in terms of it not, not opening up for everyone. And something that I also learned in bringing Dr. Ingrid Mattson back into the point of conversation, I asked her for her advice. Because, just because I thought of it didn't make it right. So I asked her about having a shelter exclusively for Muslim women. And I use it now as my mantra. What she told me was, she said that you should never establish anything for anyone without at least inviting them to the table. And so what I did was, I asked the Muslim sisters, how would you feel in terms of if other people were invited, other faiths were invited, or even if it was, just their backgrounds. And what they shared with me is that they would not feel safe. They wouldn't feel safe in an environment where, if a person has a different, a moral base than you, or a different, views on life, then it's not going to be a sanctuary for Muslim women. It will be just a place where they're maybe away from the abuser. So they've gone from one form of an abuse to another type of abuse. And it makes them have to then not feel like, okay, you know what, I can practice Islam. And even though it may create a differences of opinion, I go by those who are there in the house. And that's what they say. That they want to be able to feel that they're in an Islamically conducive environment. So now answer to your question, I didn't forget it. Well, answer to the question is, I say all that to say is that what Muslimat al-Nisa needs is the financial support from the Muslim community. because we operate solely on donations. So the numbers I'm able to accept are based on the amount of donations that come in, because I live in a shelter. I don't take a salary. And I'm actually, I'm a chaplain, a nurse practitioner, I have all these other things, but I tell people, I don't do it to be magnanimous. I want to have my own place. I want to have, a salary or whatever. But if I do that, it will lessen the number of people that I can help, because I would have to take money away from to go toward like my own personal expenses. And one of the things that I'm not good at, have a list, but one of the things that I'm not good at in terms of boundaries. So if I'm the one who received the phone calls, right? Because the people can call me directly. They call me up and say they need a shelter, and I hear their sadnesses and their sorrows and their stories about what's going on. These are my Muslim sisters. I'm going to cry with them. I'm going to be sad with them. I feel exactly what it says. When they're in pain, I'm in pain. And if I was good at what I did, mashallah, I would be able to separate one from the other, be a business person. But I realized I'm not a business person. I never started this to be a business person. It was because in wanting to care for Muslim women, I didn't know what else to do but to be able to provide a solution for those who had no solutions. And I was in a position to be able to do that, because I didn't go to school to just start out being, dealing with shelter. I went to school to be a nurse practitioner.
Alhamdulillah, I think that's wonderful, and jazakallah khair for answering my question.
I don't know. Did I really though?
You did. I think alhamdulillah that you are taking this course of living in the shelter yourself and taking care of people to ensure that you can help the most number of Muslim women. That is truly humbling and wonderful to hear. And may Allah, inshallah, make it easy on you and all those that you help, especially during this difficult time. And now I might be incorrect. I might be correct in saying this. I've been incorrect a lot of times on the show so far. One of the causes of domestic violence is substance abuse. Would you potentially agree with that, Sister Asma?
Yes, and I do have one story, but I don't know if you can come back to me, because I didn't realize this until last year. I don't know if I have it was actually, let me tell you this. A sister called me and she was here in Baltimore, and she said that she needed shelter. And I said, why? She said she was addicted to cocaine. No, was it cocaine or heroin? It was one of the big ones. All right. She said she was addicted. And so I was like, well, what happened? She said that she actually said that she was in a refugee camp. She was in a refugee camp. She said, she said they're not safe, that they were raping her. She had a husband and 2 children, and they were raping her, and that her husband couldn't do anything about it. So basically what they ended up doing is, because she was in pain, it was this constant pain, and because they started trafficking her. She was a very beautiful sister, and they were trafficking her. And she said that they gave her the drugs in order to ease the pain, so they could keep doing this. Eventually she got out of the refugee camp. She got into when they, she finally got, I guess, the okay to come into this country. And then her husband said that, she said, and that's how she opened her, she said that he refused my bed. He refused his bed. That's what, and she's taking it from Quran, that he didn't want her in the house anymore, and he didn't want her around the children because she was soiled. And the part that broke my heart so much is that I couldn't take her, because I didn't have the ability to care for someone who had a substance abuse problem. And so it is definitely something that's needed in the Muslim community. If I had someone that I could put her in a shelter, but then put her with a program, alhamdulillah, I don't know what happened to her, but it was the saddest thing. And then that's when I found out that she told me about others. So they may have, and people may come out, I mean, they may tell me, but this one hurt me the most because of the fact that it wasn't her own decision.
Wow, subhanAllah, that's
A
very
sad
difficult to hear.
yes.
Alhamdulillah. You know, one thing that potentially might help out is our next guest.
Yes. Alhamdulillah.
Yes, alhamdulillah. We have a substance abuse expert in the field. Alhamdulillah, it's my honor to welcome, and Jazakallah, by the way, Jazakallah khair to Sister Asma Hanif of Muslimat Al Nisa for all your wonderful work and for joining us tonight. Inshallah, I will put down right here in the description box information about contacting Sister Asma for assisting the shelter, or if you know someone in need, inshallah, reach out to Sister Asma and we can try to make something happen in this time, inshallah. So our next guest is Brother Abdul Malik Lion. I believe I said that right.
Correct. Jazakallah khair.
Alhamdulillah.
Thank you, brother. Bismillah, alhamdulillah, as-salatu was-salam, Rasulullah. You know, and just building off of what Sister Asma had already said, the dynamic has shifted dramatically with the inability to leave the home. And most substance abusers will tell you that the home is often where those triggers are actually started. So now they're being told to stay in the place that's dysfunctional for them, at least, which is the root of the problem. So now we have uh, like almost an explosive mixture where those triggers are happy. Let's say someone's in recovery and they are actively in recovery, and some of their triggers are their partner for whatever reason. It doesn't matter why. Now that ability to cope with that may be for them to step outside and go for that walk or go to the local store for a moment, and that has been taken away in a sense. So all of these dynamics are not only contributing to more substance abuse, but also the overlapping dynamics of domestic violence and substance abuse, which are often hand in hand, is just being exasperated. And one of the things that struck me when Sister Asma was saying was that she can no longer send the cavalry. She can no longer send those people to California who are, you know, a country away. So that logistical ability has been cut off. And one of the things I would be interested immediately in is how do we, you know, what are the barriers explicitly, and how do we address those, if at all? And then, of course, when the lockdown, the countrywide lockdown does abate, how do we address the onslaught of cases that are bound to present? So there's a lot to tackle. Now, on a lighter note, for those who are in recovery, and that is more or less the extent of their problems, and they're just facing harder times, and the inability to release the way they normally do, maybe. This is what I would like to focus on tonight, and that's just, you know, basic coping mechanisms. And I don't, you know, I've been trained in all of the classic coping mechanisms, you know, breathing exercises, all of them. I find that on a personal level with the client, that you meet them where they are. It's a very simplified method, and that comes from conversation. So I've found in my travels that as long as I'm meeting that person on their level, especially since I come from experience, then I'm able to develop the relationship that will eventually, hopefully, lead to long-term treatment.
Alhamdulillah. It's wonderful to hear. So you work on setting up the treatment mechanisms to create long-term treatment. Could you tell me a little bit more about how we can apply some of that, especially in the circumstance of the coronavirus pandemic?
Mm. And knowledge is everything. Education is key. So getting that into the hands of the people who are in recovery is key. Uh, Material, literature, anything you can get your hands on. We still have the internet, alhamdulillah, for that purpose, for good purposes. I'm a bookworm. I love books. There are a few key note books out there for those who are in recovery. my first suggestion would be to return to that. Return to those things that got you into recovery in the first place. What was it? Was it a book? For me, it was the Quran. That's easy. And that just fits right in line with what I'm already doing, right? So, but for those who are maybe a little outside of their deen at the moment, what was it that brought you back into sanity? What was it that brought you back into society? What was it that allowed you to start to repair those relationships finally? So this is what I'd like to tell people. Focus on the simple things. Don't make it overcomplicated, because if you do that, it's going to stress you out and you're going to get more anxious. Tell your story to yourself again, because everybody has a story. And that story for your recovery started somewhere with some event. And for me personally, when I look back to that time and tell that story again, maybe, I find solace in that. And there's a lot of solace because I find that solace directly related to Allah. So for me, the deen and recovery goes hand in hand. They're interchangeable. They're one, which is a great thing. But there are secular approaches that do help. That help with getting the body and the mind back into a homeostatic place where you're on an even, not only on an even keel mentally, but biologically speaking, eating the right things, doing a little bit of exercise. These are things you can do in your home, changing your diet, having a 10-minute conversation about something you like or about something your partner likes. Maybe stepping outside of yourself for a couple of moments and seeing if you can do something for someone else in the home, a family member. If there's more than one in the home, there's 3 or 4. We could always turn back to family board games and having movie nights and lots of things that can hopefully bring the family dynamic into a functional place. But listen, that is not always the case. So what do we do when that's not the case? We have to identify some serious we have to identify the triggers for that individual. So that would be another first step. First, identify where you started your recovery and try to highlight those things. Second, identify your triggers, or you can make that the first thing. They go hand in hand because the triggers are always what sets a substance abuser down the road to use again. And it can be a combination of many small triggers, which build up over time, or it could be one trigger that's just massive and it just unleashes a flood of emotions. Something that maybe happened in their family, someone died, anything. And then of course you have the impact of maybe they lost their job. The family dynamic was already dysfunctional. So it's all just being exasperated and no relief seems to be right around the corner. So getting back to knowing what works for you. When I say coping mechanism, I don't want to say the cookie cutter coping mechanisms. I mean, what do you like? What is it that brings you joy? Is it reading? Is it biking? What is it? We have to identify that and then build off of that, right? I would love to think, ideally, as it is for me, to find peace and solace and to come back to a lucid state of mind is prayer, salah, and Quran. I was not raised in Islam, so for me, anytime I'm learning Islam, it's an adventure. So that's great. That works for me, but that may not work for everyone else. So that's my main advice, just to get through this time, because anybody who's in recovery knows this is not a short-term thing. Even after the COVID-19 is over, if they're in recovery, it's a lifestyle. They won't leave that. It'll maintain itself. But I would suggest these minor things, and of course, always networking, 100%. If you have someone, and especially if you're in an active program, call your sponsor, please. Call anyone who's in your support network that is willing to speak with you for more than a few minutes and support you. That has always been a very good way to get over an initial urge for substance abuse. Now, this does not necessarily address the domestic violence side. I'm not trained in that, and I would defer to Sister Esma for that specifically. But concerning concerning the substance abuse, that's my general advice.
Jazakallah khair, Brother Abdul Malik. I think that's wonderful to hear. Go back to the story of when you were in recovery. What helped trigger that? And for those that are going through a substance abuse situation, that's very beneficial. But also for those that, as we come into Ramadan, it could be a wonderful opportunity for us to keep reminding ourselves of our intention, of what is causing us to go down this path, that Allah subhanahu wa ta'ala instructed us to fast and to continually remind ourselves that we're fasting Allah subhanahu wa ta'ala's benefits. Or if we're trying to stop a bad habit, say drinking too much coffee, thinking about what led us to wanting to stop drinking this coffee so much in such large quantities, it is a great reminder and a great motivator to prevent us from relapsing. So Jazakallah khair for sharing a bit of your story there as well and giving us some tips. Now I'd like to pull in a third and final panelist, someone who kicked us off on the first Mental Health Monday, Dr. Shaida Maroof. Dr. Shaida, as many of you know, is a psychiatrist. As many of our guests, also a member of the IAR mental health team and hosts the Hope Sisters Halakha. Dr. Shaida is wonderfully trained and has been a great addition to the team, the IAR mental health team. And that's available at raleighmasjid.org/health. And we also have a new page on the new and improved Imam's Corner. And you can get more information about the virtual trainings and the virtual referral services the IAR mental health team has going on over there. And you can contact Sister Asma for advice as far as domestic violence abuse goes, and Brother Abdul Malik, as well as Dr. Maroof. So I'd like to welcome on Dr. Maroof, inshallah.
Can you hear me?
Yes, I can hear you, Auntie.
Yeah. It was very interesting listening to both the speakers. And I was thinking, how do I see? Because I see mostly children, adolescents, and adults. And where does this domestic violence, what is the origin? What makes that person take that action? There could be a lot of psychodynamic factors, the way a person is brought up, developmental history, has he been exposed to any trauma and abuse? Because that is instilled in him, and that is what he has learned, or he or she, I doesn't want to just but that is a very unhealthy coping mechanism. But again, as a psychiatrist, I see that there are other mental illness which can predispose somebody to aggression and violence and drugs and alcohol abuse. Take a simple case of ADHD. It is parents get concerned that for starting kids on medications, which are stimulants, which could be addictive, and they worry if they are causing more addiction in the kids. But the studies have indicated that if untreated ADHD has a higher incidence of drug and alcohol abuse as teenagers and adults. So, because the thing is, there is lack of the kids with ADHD, and even adults with ADHD are very impulsive and reckless behavior, and they are always, along with that goes poor self-esteem and wrong peer group, and with that goes wrong choices. So a lot of higher incidence of drugs and alcohol abuse. And the other factors are even mood and anxiety disorder. When you talk about alcohol acts like Valium. So people who have underlying anxiety disorder, they try to, once they take the drink, it is so relaxing and calming that it becomes addictive to them. Especially people with the social anxiety disorder, where they have fear of scrutiny, embarrassment, what people think about them. And if they have to go to a party, it could be a social gathering from job or anything, and it is very hard for them to interact with other people. That is when they realize if they start drinking, it is such a calming effect that it becomes they're able to be more laid back, more relaxed, and interact with others. And that is such a good feeling that it becomes an addiction after that. And even for anxiety disorders, again, if the alcohol acts as a Valium, then all anxiety disorders with excessive fears and worries is also the easiest way to treat is the go to alcohol. The other not only alcohol, but the same thing we have to worry about prescribed medications like Klonopin and Xanax and all that. Those are very, very addictive medications. The more you take it, the more addicted you get more addicted to those medications. So it is also partly responsibility. The doctors are also, it is iatrogenic factors also, because doctors are so easily prescribing these medications, which are very addictive. I have a patient, I remember, as a teenager, she fell down and broke her ankle. She was admitted to the hospital, had the surgery, and upon discharge, she was given pain medications, and she was given pain medication for a month. Studies have repeatedly indicated the role of pain medication is only for 2 or 3 days. After that, it is just a false sense of well-being. So if you're giving a patient a prescription for a month, they're using it, and now they get so addicted, it releases the pain medications or any addictive chemicals, it releases the endorphins, and it affects certain areas of the brain that human being begin to like that, and it is hard to let it go. So this patient of mine, who I was saying at the age of 16, she started on pain medications. Then she started hunting for hunting for benzos like Xanax and all that. At the end, she also used to take her dog to the veterinarian, saying that the dog is having anxiety, and get the Xanax for the dog and start taking the Xanax which was prescribed for the dog. So these are all situations which, if they're identified earlier on, it can be taken care of. Otherwise, it's a very tough road. And once you get into severe addictive issues, then it is very hard road. Unless you have that insight to get better, then it is very hard to get back. So, and in those situations, somebody called me this morning about a Muslim girl wanting to see a Muslim psychiatrist because she has had problems with the alcohol, and she wants to see it. So when I see Muslim kids or even others with drugs and alcohol abuse, I always tell them, I provide them with a lot of support, that it is never too late. You know, it is only Allah is the forgiver, and no matter where you are, you can start today. Today is a new day, and that gives so much support and enthusiasm for the health seeker, for the patient, that already they are feeling bad and guilty about it. That doesn't mean they have to stay in that state of mind. At some point, when Allah guides you, you want to come out, it is never too late. And that is the role of a therapist, to provide that support and help. And Islam is the best religion. You don't have to go to a priest or a preacher to ask for forgiveness. You ask Allah for forgiveness and you start from there. So it's such a good, yeah. Oh God. Yeah, so that is what I have to say. And
Jazakallah khair, Dr. Maroof. I think it's very poignant, and it's a wonderful place to wrap up at on this discussion of substance abuse and domestic violence as well. Now I'm going to give it back.
Kashif.
Yes.
Brother Kashif. I just wanted to give a resource. I believe one of the initial points or questions, even, I can't remember.
I'll bring it back to you in a second. I'll bring it back to you in a second, inshallah. I'm going to just wrap it up, and then I'll give it back to all our panelists to say a final point or two. Just one point of housekeeping before I give it all to our panelists. And then finally, Dr. Maroof, do you mind closing us off with a dua tonight?
You know, ask Brother.
Okay, I'll ask Abdul Malik, would you mind closing us off with a dua tonight?
Not a problem, brother.
Okay, perfect. So
Bismillah.
Before we get to that point, I just wanted to ask your permission. So point of housekeeping. Tonight is the last night. We're going to be starting at 8 o'clock. Inshallah, tomorrow on Tuesday, April 14th, we'll be starting off the live stream at 8:30, inshallah. This is to allow for Maghrib. And we'll also try and keep it a little bit shorter to allow for Isha. And I know there's some programs that people like to check out at 9 o'clock. So inshallah, tomorrow night we'll be starting at 8:30 as opposed to 8 o'clock. Now I'm going to pass it over to Sister Asma. If you have any closing thoughts or resources, suggestions, please let us know.
How much time you get? 1 minute to do the closing thought?
I'll give you 2 minutes.
Okay, good. The reason why is because I actually wanted to make a comment to Dr. Maruf about children. And I want to tell my Kit Kat. I have this story I call my Kit Kat story. When I first started doing this, I said my point was to be able to eradicate domestic violence in the Muslim community. And then I had a sister who came to the shelter, and at 3 o'clock one morning, she woke me up and she said, Sister Asma, I need a Kit Kat. I need a Kit Kat. And I said, okay, what's happening? Maybe she's diabetic. Maybe that's what's happening. And instead, she had her 3-year-old son. He was at her knees and he was saying to her, he was kicking her. He was beating the mother because he wanted this Kit Kat. And I was like, oh my goodness. And that was at the point that I realized that we will never be able to eradicate domestic violence. Why? Because the abusers of tomorrow were already born. And so this is what happened. It means that if he's beating his mother and she's accepting it, that this has come from the father, that he's seeing this behavior in the father. And then the daughter is also, she's seeing it and she's older and she knows that this is the behavior that is acceptable for a girl to have. And so what the mothers tell them is that it is better to be dead than divorced.
Okay, yeah.
So that's the cycle. So I wanted to tie that in when you were talking about in terms of the children, that's absolutely where it begins. And if we can't stop it there, mashallah.
Yeah.
SubhanAllah, perfect that Dr. Maruf, that you've tagged her in this. I'd like to pass it over to Dr. Maruf. If you have any final closing thoughts or resources or suggestions people can check out.
I want the community members to know that there is always help available. Don't think that we are Muslims and we don't have drug and alcohol abuse and domestic violence. We have it as much as the other society. Probably we have it a little bit more, but people are scared to talk about it. There is no harm in going out and getting help, and there is a lot of help available, and there are different reasons why people get to that point. And at the end of the day, with the help of Allah, you can get better, inshallah.
Jazakallah khair. All these panelists wonderful today. We were wonderful at segueing into each other. I really appreciate that. Sister Asma segued into Dr. Maruf. Dr. Maruf segues into the importance of Allah subhanahu wa ta'ala. And Brother Abdul Malik is going to give us a nice dua, inshallah. So Brother Abdul Malik, feel free to wrap us up and lead us in a nice dua, inshallah.
Thank you, brother. And I just wanted to note, simplicity is key in times of stress. Networking is key in times of stress. Islam is simple for a reason. It aligns with our fitrah. And when you get back to that, and I speak first for myself before anyone else, when you get back to that, then you can find peace in the heart and mind. Bismillah, alhamdulillah. None has the right to be worshipped except Allah, the forbearing. None has the right to be worshipped except Allah, Lord, the magnificent throne. None has the right to be worshipped except Allah, Lord of the heavens, Lord of the earth, and Lord of the noble throne. Ya Allah, I ask you to bless all of those afflicted during this COVID-19 pandemic, and I ask for a speedy recovery for all of those that are afflicted with domestic abuse and substance abuse. I ask for an exit plan, for a way out for those who do not find a way out in this time, as they're being told to stay home in the very dysfunctional dynamic that creates the problem. Ya Allah, I thank you, and I thank you, and I thank you. Ameen.
Jazakallah khair. Ameen. Jazakallah khair to all our panelists, Sister Asma from the Al Nisa Center, Brother Abdul Malik from kind of everywhere. You're part of the Polk County Correction System, helping out with the Jummas there and doing a lot. And Sister Shaida, Dr. Maruf from just down the road. You have your own psychiatry practice, alhamdulillah. So Jazakallah khair to all our panelists. Jazakallah khair to our audience. Inshallah, I will see everyone tomorrow at 8:30 p.m. We have Imam Muammar, and if you want to connect with any of our panelists, feel free to reach out to them via the IAR mental health team or the Imam's Corner page on the Raleigh Masjid website. We'll have information for all of them there, inshallah.
One last resource.
Yeah.
Okay. Hanover County, Wilmington. You can go to health.nhc.gov.com. health.nhcgov.com/opioids. If you know someone who is dealing with an opioid crisis, or you yourself are looking for help, I think that would be one good resource for you in the Wilmington area.
Jazakallah khair, Brother Abdul Malik. Once again, Jazakallah khair to our panelists. Jazakallah khair to our audience. Inshallah, I will see everyone tomorrow, 8:30, same place, raleighmasjid.org/live. Jazakallah khair, everyone, and have a wonderful night.
Thank you.
Assalamu alaikum.
Wa alaikum salam.